We are going to start with our first session now, with our open headliner on this track, which will focus on the promise and peril of AI in healthcare. Here to share his thoughts, please give a very warm welcome to Kevin Kiley, the president of Airia. Thank you.
Good morning. Good afternoon, or good morning, I should say. It's a pleasure to get to address you all today and to talk about a topic that I feel is so important and something that across our lifetimes we will see have so much impact on all of humankind. I want to apologize. I recognize the audio is a little difficult with the competing rooms, so I'll try to speak up and ensure that we keep this audible enough for you. My name, as mentioned, is Kevin Kiley. I'm president of Airia, and I'll tell you a bit about our company towards the end. My background, though, prior to this company, I was part of the leadership team at several other technology companies, AirWatch, which was a mobile device management company, which played a critical role in deploying mobile devices 10, 15 years ago into the healthcare field. And it was there that I first saw how much technology was already starting to impact the way that diagnostics were being done, the point of care solutions, and the way that physicians and nurses and other care providers could really get close to the patient. AirWatch grew very quickly on the basis of our success in healthcare, and then also expanded across a number of industries. We sold that company to VMware in 2014 for $1.54 billion to VMware. And after a couple of years hanging on, myself and several of the other leadership team went on to build another company. You may have heard of OneTrust. OneTrust was a compliance solution for privacy regulations like the GDPR, but also had a number of areas of impact on healthcare organizations around the world and ensuring their compliance and security programs were up to speed. So that company also scaled very quickly from 0 to 3,000 employees and 14,000 customers in the span of a few years by several metrics, the fastest growing enterprise software company in history. And again, it gave me great insight into the way that care providers could use some of these solutions to build their organizations in sustainable ways and also staying compliant and protecting sensitive data that organizations are entrusting with us. Now, I mention all that because, again, it helped inform a lot of what we're doing today in healthcare at Airia. It also it really taught us how to build products and solutions that could scale and meet the demanding needs of healthcare organizations around the world. Airia is an AI management company, and that's what I'm most excited to talk to you about today, is specifically how AI will impact the way care is provided. As the topic behind me shows, there is tremendous potential for AI to have a positive impact. All of the promise will spend the first part of my talk this morning talking about that. The second part about some of the more recent risks and threats that your program will have to prepare for and be ready to address as they arrive. I'll begin by talking about some of the trends that we're already seeing. And I think one of the most common ones across healthcare organizations around the world are virtual health assistants. AI presents so much capacity to understand not only common medical knowledge and conditions, but also patient history, and provide all of that in a way that is accessible. So again, a good chunk of what we'll talk about today are virtual health assistants and the way that those are impacting the provision of care. The second, AI and medical imaging, another area where AI has not only tremendous scale, but also speed of being able to make improvements in diagnostics and looking at not only imaging, but other testing that might be happening across a provider to identify where there's a concerning variance, something that needs to be addressed, something that might present a greater concern. The third is an AI-augmented workforce, as care providers are in demand anywhere you go around the world today, and their time and their resources obviously are a huge strain, and some countries more than others, where there simply is just not enough staff to go across perhaps an aging population and meet the care needs that that population represents. AI will have substantial impact in being able to scale and prioritize where the additional attention and expertise as well as resources are needed across these underserved communities. So I'll talk about all three of these as a trend and something that I think we're going to see a lot more of, and the way that these areas will be impacted by AI and its capabilities. Today, we can see that there's already a lot of appetite for it. And this is just a recent study that was published a few weeks back, so a good data point to start with. But the first area is clinical decision support. Being able to make those critical choices early on, and when time is urgent, when, again, resources may be limited, and a physician or a nurse has to make a critical decision in a short amount of time. AI can draw upon vast amounts of data across similar populations or similar demographics to understand what the right diagnosis might be, as well as the right course of action from there. We also see its ability to ingest, again, data from this patient's history or the family history and be able to make far more comprehensive reads across the data than a physician's going to be able to do, particularly under short time demands. Closely related to this, the second category, predictive analytics and risk stratification, being able to qualify and categorize the risks that might be present, make those decisions, again, about what could be coming, and try to take one step ahead of the risks that the physician or the care provider should be preparing for. This is, again, something that we'll see continue to grow and expand. Right now, the early deployments have already shown great promise, but the technology and the power, the compute that will be available to really supercharge these is still yet to come. I think this is one area in particular over the next 12 to 18 months that we're going to see a lot of really positive performance data coming back on. And organizations and the early sort of pilots and test cases have shown that this one area has, again, so much promise. Third area would be clinical workflow optimization and automation, where we know that so much time for a care provider is spent doing administrative tasks or double entry, putting my notes into one system and then having them have to be re-entered again to another system. And in my country, in the United States, again, there may be a third system that provider is having to put the information into to make sure that it's coded correctly. The insurance, the provider, the payment provider is going to be reimbursing for the charges, and that these would be an approved condition. This is a tremendous tax on the way that care is provided and the ability for doctors and nurses to spend time really focusing on serving the patient, because so much of that overhead that we carry around documentation and simple administrative steps across the workflow. This is, again, an area that we're already seeing a lot of really early progress in, and many of the tool providers have made great strides in. So this is one area I would say is probably a little bit more mature, where today across a number of health systems around the world, you'll see physicians being able to have their notes transcribed in real time on the screen. The agent or the health record may be inputting suggestions and sort of suggesting things to them in terms of the provision of care. But most importantly, ensuring that it's all accurately and appropriately entered into the record, keeping that physician from spending time at the screen, going back over their notes, re-entering things, and still perhaps getting it wrong and creating other challenges down the road. This will save enormous amounts of time and resources that can now be given back to providing care and really doing what those doctors, nurses, and other staff are trained to provide. The fourth, treatment and therapy recommendations for providers, something I alluded to in that last topic, as we are bedside with a patient and perhaps providing the care, that doctor now getting prompts. And again, this is very early, but we're already starting to see some good examples of this happening in the way that it's been able to impact care providing. Doctors now having a whole variety of conditions being considered in real time while they're talking with the patient, helping them to not understand what the condition might be, but to think more broadly about other potential issues that could be causing it, directing the line of questioning, helping the doctor to really make informed decisions about what the condition might be that they're seeing in this patient or in this situation. And it's beyond just doctors. This is going to be something that impacts a variety of staff across the facility, giving them information to stay one step ahead. And again, proactively ask the right questions, get the right information, so we can minimize the guesswork, rule out conditions that might not be applicable, and get to the core cause that hopefully results in the right outcome for that patient much faster and much more accurately. And then, of course, closely related to this, diagnosis and treatment recommendations. Not only are we seeing that the systems can now prompt and help drive the right decision-making through the visit, but also the right outcomes for the patient. As a physician or care provider, it now gets clear direction from the system based on, again, a whole host of data. It will go well beyond just what we've asked and what we've seen in the visit, past diagnostics, lab work, etc., all being considered, as well as that broader population data being ingested at a scale that is beyond human capacity. So that physician can now see a much more clear picture informed by the work of AI in providing suggestions around what the diagnosis might be, but most importantly, the treatment and remedy that they want to send that patient to. So huge impact. And I'll emphasize again, as most of us know in the room, this is only starting to make its way now into the exam room. And we'll see more and more over the next year in particular. The pace of change will just continue to accelerate as to how these systems, these technologies can start impacting. This top 5 list here, I think, will also evolve. There are a number of areas that we probably won't be able to get into today. But these are the ones that were front of mind on this most recent study. Now, there are a number of challenges, and I'll spend some more time on this, but at a high level, when we talk specifically around AI in healthcare, we know that there are still really strong concerns around accuracy. And while this is early, as I mentioned, we're seeing improvement already, there are still problems with systems having hallucinations, errors, where the tool simply doesn't know, and yet, based on the prompting, may come back with an answer that is just not right. And this could be, again, a life or death sort of situation. Guardrails are being put in place for many of these, and I think most organizations would still acknowledge that this is only meant to be a support system. No one is going to fully entrust the systems to do it, but it's there to help perhaps prompt and suggest things to a physician. These accuracy concerns will continue to be a real hindrance, though. If we can't get past them, if we can't start to develop that level of trust in the way that they're performing and with the output that's coming. I'll talk about some of the solutions for that in just a moment, but accuracy concerns front of mind. Second, data security risks. This information, of course, is inherently sensitive. We know that the data that is being fed into the tools represents a real risk to the patient, to the individual, and there are not only consequences for them, but also for the provider in applying the right security and protections for it. The third would be bias in the data. Again, risk here, of course, that we get wrong information because the model starts to push in the wrong direction or is trained incorrectly, and that allows the bias to seep in. Regulatory compliance, I sort of mentioned with data security risk, is almost every country around the world now has strong regulations in place to protect the sensitive data and the way the care is provided. Obviously, a real risk here around the way that AI would be deployed, and that closely relates to patient privacy and the protection of the information for them. And then ultimately, I think coming up with all of this, trust is the big issue that so many organizations have faced. Is do your staff trust these systems? Do they believe in them? Are they going to ignore it? Are they really going to use it? Or will they dismiss it? And then, of course, your patients and your community behind that. Most importantly, the ones that we're providing some care to. Do they believe in it? Are they going to have concerns around it? These are all issues that will have to get addressed for an organization to really succeed with AI in providing care. As we do it, though, again, so much room for these to really impact not only care delivery, which we've spent some time on talking about already, but drug discovery in particular, a very lengthy, expensive, cumbersome process that can now be hugely accelerated. And again, huge wins already showing up here with new drugs being released and going into their final stages of testing. And processes that might have taken years that we're getting to in a matter of months in some cases. And then the third area I would point to is patient engagement. Again, we talked about the critical staffing needs of the profession. Patient engagement is something that can be hugely enhanced because now I've got an assistant that can give some low level of engagement and also asking the right questions, providing information back, trying to provide some level of knowledge back to the patient, and 24/7 without limits on how they scale. This is another area that, again, I think we'll see some great work in over the year ahead. So summing this up, though, transforming patient monitoring will be another big area that we can rely on as these new systems come online. The ability for us to support patients anywhere, at scale, anytime, anywhere, across geographies and markets will be hugely impacted. Proactive interventions, being able to look for those subtle, disparate signals across the way that a patient is testing or conditions they're reporting, and be able to proactively get ahead of conditions before they become acute, which relates to early detection and predictive insights to other categories. All of this ultimately serving up to enhance the outcomes and deliver better care through the use of this technology. We will see massive improvements in our lifetime across this, and probably just in the next couple of years, I really believe. So lots of examples around the world. I want to spend a few minutes though talking about how to get past these, because I've talked to several of you this morning, and I recognize that there are real challenges that your organizations are facing and how to do this. You're working with a multitude of tools in your organization. If you're a healthcare provider, you've got your electronic health record vendors, you've got other solutions, diagnostic tools, other systems. You've of course got the payment systems that have to also be integrated. Data integration becomes a core challenge. Getting those systems to talk to each other, the interoperability, but making it not just work today, but making it sustainable will become a big challenge. Security of these systems, unfortunately we are already seeing bad actors attacking major health systems around the world and trying to either use ransomware attacks or just simply disrupt, and even some of this may be nation state. Security will be a bigger and bigger issue. Just in the last few months there have been several examples. I'm going to give a talk this afternoon that will highlight some of those and talk about core sort of risks, use cases that many organizations are facing. The third down the left side of the screen here is cost, and there's a lot of unknowns here for many of your health systems. Many of you are already under pressure to deliver better outcomes with very limited budgets. Cost becomes a real issue. We know that there's a huge amount of investment going into some of the tool providers, all of these LLM builders, and many of the related parties that work with them are putting massive investments. They're doing it because they believe they're going to be able to get that money back and that they're going to have big paydays. That means that they're going to be charging a lot, and some of you are facing those bills already, but expect those to grow. So controlling these will become an issue, and again, in most organizations, it's very difficult to forecast or predict. Legal and IP, we've talked about some of the regulatory concerns, but also protecting the sensitivity of the information. And if you're building your own systems, if you're doing drug discovery, how do you protect that IP when some of this is going out to public models? Regulatory and governance challenges, and then brand and reputational, which I'll say is again a matter of trust, will become core for so many organizations. So the net of this, though, is your healthcare organization's data has always been a critical asset. That's never been more important as we move into this next era of AI care and the way that care is provided across the system. Going forward, it's not just your data, it's now your AI, it's the integration, it's the models, the prompts, the way that you're interacting, the tuning of the model, the policies, and ultimately the governance. This is what will help you to survive as we go through all of this change and this revolution in the way that care is provided. So having a platform in place is something that we're here to talk about today, and that's why we are at so many of these healthcare conferences where we perhaps engaged with you or your teams in the past. Having a system in place that will give you those protections, that allows you to manage the AI across the system, will become a critical responsibility of your team to provide them. I won't go into a lot of detail here, but we do have a large booth out on the floor. We'd love to talk with you a little bit and offer you one of our workshops. We do these workshops across health systems around the world. allowing you to define those core use cases, quickly integrate the data, build out your first agents using the right models, creating workflows that can help support the provision of care or drug discovery or whatever it is that you may want to solve for. We'll help you build the prompts, get the compliance in place, and get everything into production so that you can really go leverage AI across the way that your system is providing care. We'd love to talk to you about this. As I said, we have a large booth out on the floor with a team out there that has deep expertise in healthcare use cases. We'll also be providing a number of white papers following this talk around AI in healthcare. And if you'd like to get one of those or if you'd like to get a copy of the slides, please scan the QR code, or if you want to give me a business card afterwards, I'll be glad to send them to you. Thanks very much for the time this morning. It's been a pleasure to address you.